Hello, everyone. We are pleased to have you join us for Cardinal Health Lab Exchange. Welcome to today's live broadcast, Foundations for Lean. I am Judy O'Rourke of LabRoots, and I'll be your moderator for today's webinar. We are delighted to bring you this educational web seminar presented by LabRoots and sponsored by Cardinal Health. Cardinal Health is a Fortune 22 company that improves the cost effectiveness of healthcare. As the business behind healthcare, Cardinal Health helps pharmacies, hospitals, ambulatory surgery centers, clinical laboratories, and physician offices focus on patient care while reducing costs, enhancing efficiency, and improving quality. Cardinal Health employs more than 34,000 people worldwide. For more information, please visit www.cardinal.com. We have a few important announcements before we begin. This webcast is designed to be interactive, and we encourage you to ask questions during the event. You can submit questions by typing them in the Q&A box, which can be found by clicking on the green Q&A button at the lower left of the presentation window. We'll try to answer as many questions as we can. You can enlarge the slide window by clicking on the screen icon in the lower right-hand corner of the slide window. If you have any technical problems viewing or hearing this presentation, please click on the support button at the top right of your presentation window or submit your problem through the green Q&A button lower left. I would now like to introduce today's speaker, Chris Dillinger. Chris is the Director of Operational Excellence for Cardinal Health. In this role, Chris has responsibility and governance for enterprise operational excellence and lean leadership development programs for Cardinal Health, spanning 35,000 employees in multiple continents. Chris is a certified Lean Six Sigma Master Black Belt. He has 25 years of healthcare industry experience, including leadership positions in the areas of laboratory, corporate health, and operational excellence. Chris serves as a coach for the Ohio State University Fisher College of Business MBOE program and the Academy for Excellence in Healthcare. I will now turn it over to Chris Dillinger for his presentation.
All right, well, good morning and afternoon, everyone. Welcome. On today's webcast, I would like to share some guiding principles of Lean with you, and we're going to talk about the key elements of a Lean management system, specifically leader standard work. Lean and the management system are powerful catalysts for operational and cultural transformation. But first, let's ground ourselves on the current landscape of healthcare. It's from our viewpoint, formed from many different points of access around the business of healthcare, that the healthcare model today is really unsustainable. Okay. So first, we have aging seniors. So the population is getting older, and about 10,000 people every day become Medicare eligible. We also are dealing with more and more chronic illness, as for example, 30% of American adults are considered to be obese, which is double the percentage in the past 3 decades, and approximately 32 million additional people are gaining access to care. So we are faced with the challenges in healthcare of more people, sicker people, and less money to take care of them. And oh, by the way, there's still the existing demand for better care and outcomes with higher consumer satisfaction. So hospitals as well, facing those challenges, also have to deal with declining reimbursement rates, as this graph shows that over time the amount of money being available for payment is reducing. So healthcare providers are facing enormous pressures, and new federal mandates will require hospitals and other healthcare providers to run more efficiently and to improve patient outcomes. Also, with more and more people entering the healthcare system, and with the reimbursement rates declining. So providers are looking for new ways to reduce waste and take cost out of the system, as well as finding new ways to innovate and deliver their valued services. Within the lab specifically, we have some additional challenges that we are facing, including increased competition, technology advances, labor shortages, care is being delivered closer to home, and as well as many of the traditional lab services become commoditized. So as I mentioned earlier, that lean itself is a powerful catalyst to help drive operational and cultural transformations that are going to help either hospitals or independent labs survive in this new world. So in Cardinal Health, we went on our own lean journey, and I don't want to get too deep into this, but I do want to share a little bit of the perspective and the challenges that we faced going through our concept to reality. So back in 2004, 2005, Cardinal Health started what we call operational excellence. And originally our focus was very much on just general process improvement, quality and focusing on the quality and the operations part of our business, and it was to drive cost out of the system. And at the time, we had a significant rush to the classroom. We brought it hundreds and thousands of sponsors and trained some black belts and Kaizen leaders to go after the work. And at the time, it was very much tool driven. But over the early years, we saw a need to shift from this tool base to more of a value stream thinking. And then as we evolved even further, we started to shift towards more of a value creation type of a model. Operational excellence became embedded in our talent review process over time as well. So people who went through the Black Belt program, they were viewed as potentially the next leaders of the organization. And on an annual basis in the talent review process, the Black Belts were looked at as who is ready to move on into a new leadership role. We also started to shift some of our focus from just our internal operations and improving it, but also we started to work with some of our customers and doing customer trials to see where we could start aligning that value streaming and connect the bigger pieces instead of it just being internally focused. We also started to shift from our operational elements to some of our office functions, finance, IT, human resources, things like that. And over the last handful of years, there's been a more pronounced intention to make operational excellence and lean specifically an enterprise capability. How do we develop the perfect processes? And we generated these things called lean roadmaps, lean roadmap to success, where we would evaluate all of our operations on the journey that they're taking to becoming more of a lean enterprise. And then in the last couple of years, we've introduced a lean leader program. So now we're not talking about full-time resources such as black belts doing this work, but we started talking with some of our senior leaders and targeting those people to understand what it means to lead in a lean environment. And leader standard work is a big part of that, and I'll touch on those in later slides. And then in the last year, we've developed 2 new programs that, again, help us to extend that value stream, not just to working on our own operations, but we work with our suppliers and we also work with our customers to get that full value stream view. The 2 additional offers that we've implemented lately is the Academy for Excellence in Healthcare, as well as performance improvement consulting directly targeted at opportunities to further the lean movement, if you will, in hospitals and customer spaces. So the business impact that we've seen at Cardinal Health, just to give you a flavor of as you go down this, if you would decide to go down this road of lean in your organization, some of the impact that you may expect to see. For example, we saw a 55% reduction in our safety incidents. We saw improved quality on our DPM, stands for defects per million opportunities. So we saw our quality indicators go up. We saw our employee engagement scores go up by 20%, as well as improving productivity by 19%. So we, as you can see by the numbers, we had some significant increases in improvement around our performance and safety, quality, voice of the employee, as well as our productivity rates. So trying to get a little more specific now to the lab. If I were to ask what is the mission of your laboratory, I would expect that I might hear some responses like you're here to serve your patients, physicians, clients. You want to deliver high quality results. So you want innovative, innovative opportunities and services to deliver, as well as doing research. And ultimately, how do we deliver healthcare in a more cost-effective manner? So these are some of the typical responses, because those are the things that we see as being important to your patients. They're important to your customers, such as your physician clients, and also the community itself. Those are the things that they would expect from the laboratory. But the question that then needs to be answered is, but are your resources, whether that's labor or capital or space, really being used to fulfill these missions, or are they overcommitted to a non-value-added producing activity? So lean thinking, on the previous slide we talked about some of those things that are important to your patients, for example, and I hope that you would agree that those things just don't magically happen, that there are processes involved and connections that have to be made, handoffs and communication that's all important for it to work well. But these processes that deliver value, they can be broken down into steps or activities, and these activities either generate value or they do not. So in lean thinking, it's about trying to understand what value is, and to focus on key processes so that we can continually improve and increase the value being generated from that process. Much of our laboratories and our organizations and the healthcare continuum itself is very functional oriented. It's very siloed approach that we have our phlebotomists, and we have our specimen processors, and we have our technologists, and we have our pathologists, and we have the physicians. All these people operate I don't want to say independently, but somewhat independently of one another within their silos. But in the meanwhile, the value that's being driven to the patient, what's important, what is really important to the end user, end customer, the patient, is many times is happening in the background as we optimize these silos that we work in. So the question is how do we move the focus of managing and optimizing these separate silos or separate technologies and vertical departments to how do we optimize the flow of products or services that flow more horizontal across that? So here, it's really just a change of focus. Instead of having the value flowing across in the background, it's how do you bring it up front and work at what we would consider to be the value stream level, and how do we keep value moving across those silos, knowing that they still exist and more than likely will exist in the future as well. So ultimately, that lean thinking is how do we find the ways to maximize customer value while minimizing the waste. So if you're unfamiliar with lean guiding principles, I wanted to make that an objective today and at least share what lean guiding principles are and those five key elements that we focus on, particularly here at Cardinal Health. So the first one is creating value for the customer. And at the end of the day, the person who determines and defines value is going to be the customer, the patient, that end user, perhaps it's the physician. And do we really know what our customers want? Or do we have models built where we assume what they want or we tell them what they want as opposed to really understanding what's important to them and what they value? The second lean guiding principle is aligning to the value stream. So how do we create the eyes for seeing waste and work to eliminate activities that do not add value to the customer? Just like the slides before when I talked about that horizontal view or that value stream. So an example could be, let's use a pap smear test. In traditional lab view, that may be looked at how do we perform this pap smear and generate these results in the most efficient and optimal way for the laboratory, as opposed to if you take a value stream approach, you may be looking at the entire patient experience from the time that they're making an appointment all the way to the time that they're receiving the results. So it's not just a focus on the testing component itself, but the whole experience of that gynecological visit, for example. That is looking at a value stream, because how and when a specimen is collected is going to ultimately impact how it's tested, as well as the quality of the results on the end. So how do we look upstream and downstream from the testing activity itself? Oops, sorry about that. The fourth guiding principle the third guiding principle of Lean is going to be to create flow and customer-driven pull. A catchphrase here that I like to use is batching is bad. So how do we keep whatever value exists in that process, whether that's a service or information, how do we keep it moving forward? And every time we stop, waste occurs and value is ultimately destroyed. And batching is a big destroyer of value, if you will. It creates inefficiencies. So, for example, an example in lab would be phlebotomy morning draws. Does a phlebotomist collect a specimen, send it to the lab, collect another specimen, send it to the lab, particularly if you're in an area like an ICU, versus do I collect 10 specimens and batch them and then send them all down to the lab at the same time? Because from the time that the first specimen is collected until the 10th specimen is collected, there's a significant amount of time that goes by and waiting, which can delay results. So anyway, the catchphrase here in Lean is going to be that batching is bad. The fourth point in Lean and the guiding principle is going to be seeking perfection. So how do we seek perfection? How do we speed up the process or the cycle of continuous improvement? How do we learn to fail fast, as opposed to not really understanding what root cause problem solving is, and that we make a mistake, we blame a person instead of the process, and just to have that error recur over and over and over again because we haven't taken the time to really seek the perfection, understand root cause, blame the process, and figure out a way to fix it and solve it on a long-term permanent basis. And the last one is respect every individual. So we believe that in Lean, when you're working on continuous process improvement, you need the people who do the work to be the ones who help find countermeasures and solutions to the problems that exist. We believe that they have more valuable information than the managers because they live it and breathe it every day, and we want to make sure that our workforce understands that they are empowered to make the necessary changes to the work itself, since they in fact are the subject matter experts of the work. So jumping from the Lean guiding principles to now understanding how it fits into a larger context or a larger Lean management system. And one of the key important elements of a Lean management system is something called leader standard work. So why is it important? So leader standard work is the engine of a Lean management system that allows leaders to focus on not just the results that they get, the monthly business reports that they have accountability for, but also the processes themselves. So how do they focus on the process and seek that perfection and continuously improve every day through engaging the employees? So leader standard work is real important. So just as you might have standard work or standard procedures for the frontline employees who are performing testing in the lab or performing any type of activity, in those procedures give them clear expectations. We need the same for our leaders. So if you're a lab supervisor or a manager, it's important that you have a routine and standard work in your day-to-day activities as well. Leader standard work has benefits around making this management system of lean process dependent, not person dependent. So as you have leaders come and go within your organization or get promoted into new roles, we want to make sure that the business still is able to flow and that processes and quality of results aren't dependent upon that particular individual as a leader, but more as we have a system in place that allows quality to happen and improve over time. It takes us from this environment of firefighting and dealing with the problem of today, but how do we carve out certain percentage of the time, and not 100% of your time, but how do you carve out 10% of your day or 20% of your day every day to really think about how do we stabilize our processes on a long-term basis, identify root cause as opposed to just dealing with what comes across your desk in that particular moment. So why do we want to use it? So some of the benefits I just talked about, but it really is that structured list of daily, weekly, monthly tasks and activities that the leader is going to go through to make sure that the operation is functioning well and delivering against those lean principles that we had talked about a little bit earlier. By creating leader standard work as well in the lab, you're generating that collaboration. And opportunities exist not just within the laboratory itself, but even across, I'll use the hospital again as an example, across hospital departments. So for example, what is the cadence or the routine in which that leader communicates with the emergency department? Is it once a month at a meeting? Is it never? What about every shift? Are there possibilities where you could have lab techs or supervisors be speaking directly with somebody in the emergency department every shift about what's going on, what instruments are up and what ones are down, what does the volume look like in the ED? You have the ability to address problems as they arrive of labeling errors that come up, and how do we root cause that and prevent those errors from happening the next shift or the next day. So leader standard work are standardized actions and messages, the behaviors that the leaders can execute against to deliver the business results that are needed. So as I mentioned before, this leader standard work component is really part of a larger lean operating system or lean management system. We want to make sure that I convey the message on this webcast that lean is much more than just a set of tools that drive out waste. It really is part of a bigger system, a bigger operating system or lean management system, and leader standard work is the one I chose to focus on today as being one of those key elements to that. But some of the other elements are true north, and true north is representing the strategy itself. So what is the overall guiding direction of the organization and the lean management system? Also, employee development as part of a lean management system. We want to make sure that the employees are being respected. We want to make sure that they have personal development on an ongoing basis. And this isn't just at the annual performance review when you sit down and have a talk. But it's more of on a daily basis. How do we continue to develop and improve our people and give them opportunities to grow and excel. Another component to a lean management system is going to be accountability processes. So once the manager or leader has established, what are the expectations, is what are the accountability processes around making sure that those assignments, tasks, activities that get carried out, for example. There's also visual management. So how do we educate and inform the people who are doing the work how we're performing at any given moment? So does it do us much good at the end of a month to run a cycle time report and say, hey, the specimen turnaround time for a potassium was 18 minutes, and you find that out at the end of the month, as opposed to, boy, I would like to know where I'm performing on a daily basis or even an hourly basis for that matter. Collecting ED turnaround time on a complete blood count at the end of the month and saying that it is out of expectation and out of specification, it's difficult to root cause problem solve that and get down to what the real problems are when that data is, now anywhere from 1 or 2 days to 40 days old. So visual management system and how we collect and display information so that everybody understands the work that needs to be done and current performance levels. Then there's standard work. A lean management system is going to have the built-in standard work for the procedures themselves and the work getting done for the employees performing that. But then lastly is the leader standard work part, and how do we focus on the activities of the leader. So what is leader standard work? Again, we've talked about it quite a bit, but it really is the routines, the leader routines that are necessary to sustain that lean management system and the frequency in which they happen, so that we can count on a daily basis, I'm going to do A, B, C, and D. On a weekly basis, I'm going to do the next 3 things, as opposed to, well, some days I do it, some days I don't. Can the people who report to me really count on clear communications and clear expectations from me? So leader standard work will define those actions and behaviors that are expected of the leader, and how the leader is going to interact and engage with the frontline staff. What is that cadence and what is that mode of communication, and that would include those visual management pieces that I just talked about before. But all along, there's a focus on the process and the value stream. Of course, results are important, but how do we focus on the process and the value stream that generates the value for the patient or the physician or the customer, as opposed to how do we just be internally focused on our silo and what makes us optimal, as opposed to optimizing that value stream. And as well as we want to make sure as leaders that we first seek to blame the process and not the people. All right. So what are the elements of leader standard work? So there are 6 different elements that I'll describe in a little bit more detail, but all of them are important to generating the desired results that you would want in a lean type of culture or a lean environment. So those elements are, number 1, daily team reflections or meetings. So an example would be, do I have shift meetings or huddles on first shift, where I gather all the techs in that particular work area, or even across the entire lab, pull them together for a quick 5-minute conversation to set expectations, set the pace for the day, recognize the, give employee recognition for job well done. Talk about any meetings that we have scheduled coming up that day that may take techs off the bench, or that's going to create conflicts around lunch schedules and things like that. Do we have any special instrumentation issues that we need to make sure that everybody's informed about in that particular day, that the hematology instrument is going to have some preventative maintenance done on it between 10 a.m. and 11 a.m. and make sure everybody's aware of that, and what are the backup procedures or help that might be needed, as perhaps we need to shift some labor resources around during that time period. So daily team reflections in the laboratory is a great way to improve communications and understanding. It's all in those meetings. It's also a great opportunity to identify problems, and how do we start soliciting suggestions on how those problems came about, and what are the root causes to make them go away. So daily reflection, that is a simple element that you could apply and execute in a laboratory pretty quickly if you're not already doing that. And again, that can be at a shift level, and it can even span outside the department, as I mentioned earlier, for example, with ED or ICU, labor and delivery, things like that. Second key element to leader standard work are Gemba walks. So Gemba walks is a lean term, and Gemba refers to the place where the action happens, the place where the work is done. So for example, sitting in a conference room or sitting in your office really doesn't give you a full appreciation for the work that needs to be done, as well as the problems that may exist and the opportunities that may exist to improve that process. So you might be surprised as a leader or a tech if you just took a moment, as difficult as it may be, to step back, take a breath, if you will, and observe. So if you would just have the opportunity to maybe stand back and observe in microbiology how a specimen enters the lab, how it gets processed, how the person needs to interact with the computer to get the information into the system. Where are the supplies? Where are those supplies at that they need to plate that particular culture specimen? And if you just sit and observe and think, boy, that's really crazy. Susie has to plate this media, 50 times a day, because that's the volume of this type of culture. And one of the tools that she needs to do that is, 15 feet away, and she has to walk. How do we move the materials and the supplies needed to perform the work closer to where the work happens? And many times when you just read a procedure manual, or if you wrote the procedure manual and say, oh, you just do steps 1, 2, 3, 4, and 5, seems pretty simple. But when you observe it in action and you watch it live and you see, the barriers that exist, the distance that people have to travel, the interruptions that happen. I have to walk around the end of this table. You start to identify, that maybe there's opportunities to improve the work and the way it's designed. The Gemba walks it's not intended to be a place, once again, to point fingers or blame and be observing Susie doing the work and say, boy, Susie, why don't you do this, or why don't you do that? Try this or try that. It really is a place where you can observe the work and then engage the employees for their input on how to improve the work at another time. A third key element in leader standard work is having an immediate response to the abnormalities in the process. So how do we recognize opportunities? How do we deal with those in a more expedient manner instead of waiting for a report to be generated out of the LIS or the computer system, a month later? How do we recognize abnormalities in the process immediately and take action upon those in a more expedient manner? So for example, a lean tool, even though I'm trying to avoid tools a little bit, a common lean tool and foundation of lean is going to be 5S. So 5S is going to be a methodology or a system that helps us organize the work area and create a safer, more organized workspace that allows value to flow instead of being impeded. And it also helps us to identify abnormalities in the process pretty readily. So if you picture, a shadow board, a board where your tools are kept, if you will, and the 100 ml pipette is missing, where it's easy to identify that pipette is not where it's supposed to be, and that will cause a problem in the workflow going forward. And how do we easily recognize that and deal with it and fix that abnormality immediately? A fourth key component to leader standard work is going to be visual management. So visual management, talked about that a little bit before, so I'm not going to go too much further in detail on that. But if you think about in the laboratory, there's opportunities to help us identify whether the process is working or not working. So for example, could we put something in place that's visual, that once we get to a buildup of 5 slide racks, that we take action instead of waiting for 10. That you set some things in control that, hey, once we get to 5, we're starting to back up, we need to reallocate resources, we need to take some type of action. So are there visual ways that can help us identify those abnormalities in the process, but also help us to identify what's normal and that the process is performing to expectations? Sometimes it's as simple as a piece of masking tape on a wall. That when we put our supplies in a certain area and we stack them on top of one another, maybe it's cubes of saline in a blood bank, for example, and we typically would need to have 3 of these on hand, and you put a piece of masking tape across the wall that's whenever you get below a certain point, it's a trigger for you to take some action, such as reordering blood bank saline. But you don't have to always go and count every single item or supply, but instead just have some of these visual management tools in place that anyone can easily identify abnormal situation from the normal flow, and that the process and work is happening the way expected, as well as those accountability things that I talked about before of the metrics of success. How do we post the metrics that we measure on a daily, weekly, monthly basis so that people understand where we're at, whether that's turnaround times or whether that's quality indicators, or even cost for that matter. What is our cost per test, and does everybody in the laboratory understand what the cost is, what the drivers are, and their role in that? So visual management is a huge component of lean, in particular leader standard work as well. The fifth element that I want to talk about is employee coaching. So one of the lean principles that I've mentioned before being the respect every individual, and you could argue that it is disrespectful to an employee to waste their time and effort. So we want to respect all of our employees, and as a leader, and part of the leader standard work component of how do we coach and inform and educate and communicate with our employees on a routine basis. We're not talking about the annual performance review when I sit down and talk to Susie about her particular performance across the year. That has its time and place, but employee coaching is more of that. What is the day-to-day, weekly, week-by-week interaction with an employee that you can help them develop personally on a more frequent basis, and also to hear from them, what they struggle with on a day-to-day basis, what gets in the way of them doing a good job. You know, I want to believe, and I think most lean practitioners are going to believe that everybody comes to work to do a good job, but there are things that happen, there's processes and barriers that just prevent us from doing a good job. I didn't come here today, you know, to work to mess up this specimen or to mislabel something. But what systems do we have in place that help support me as an employee and can coach me through it to help set me up for success as opposed to setting me up for failure? And the last element of leader standard work that I want to talk about is the strategy development. And all of you know, all the activities of the lab hopefully roll up to some type of strategic initiative or some type of strategic plan within the lab, because it's a lot easier to get people to understand how it all fits together if in fact that there is a strategy and a strategy in place that everybody can be, you know, pulling the ropes in the same direction, if you will. So, for example, I'll go back to Pap smears again. You know, a specific example, a lab that I'd worked at. You know, Pap smear turnaround time was 21 days, and you know, physician offices weren't leaving. We still had the business, so apparently, you know, there's no problem, right? If people aren't complaining, there's no problem. As opposed to, you know, having a strategy that you know, every female who has this test done has a level of anxiety about that test, and we want to be patient-centric. So our strategy is going to be, we want to be patient-centric around Pap smear testing. And what does that mean? It sure as heck doesn't mean that we're going to have a 21-day turnaround time while that person is waiting for those results to come back for 3 weeks, when you know that test could be performed, quite honestly, really same day. So what is the strategy of the lab, and you know, what are the values of the laboratory that we can get everybody pulling towards that will reflect the type of care that we really want to deliver to the community? So my last slide is, I wanted to highlight some specific examples of, you know, waste that exists within a laboratory, in case you're, you know, in case you are new to this lean thing and understanding, you know, what is it and what is this waste and that you're talking about. So we use an acronym. A common acronym we use is something called TRIMWOOD. And it stands for Transportation, Resources, Inventory, Motion, Waiting, Overproduction, Overprocessing, and Defects. So examples of transportation waste that exist within the lab that you'll have maybe some new eyes to recognize is moving specimens from place to place. So if you go back to the batching as bat, how often in a lab do we receive a specimen in? It might come in a courier in a big bag with 25 other specimens. It sits on a counter. Then we perform some work activity to it to get it, you know, maybe registered into the laboratory information system. And then we just move it and put it in a big rack. And it sits there in that rack. And then we move it to another place. And then we move it to another place. So all that moving of specimens and moving supplies around doesn't add any value to the patient, and it doesn't add any value to the results. If anything, it runs the risk of deteriorating the results that are going to be produced from that particular specimen. So transportation waste is a common thing that we would look for. Is what is the movement of specimens and supplies, and what is the transportation process, moving it from, you know, an inpatient floor, the ED, or from an outpatient clinic into the laboratory itself. The second one on R is resources, and this one is primarily focused around the employees. Do we fully utilize our employees in the most effective way? We have intelligent people with intelligent ideas, and do we really utilize them in the best way? Or do we have a top-down driven command and control type of an environment that this is how it's going to be done because I said so, because I was a lab tech 15 years ago, as opposed to are we engaging our employees and utilizing them to their fullest potential? All right, inventory. So supplies, the reagents, forms that we have, your email that accumulates in your computer system, all of those are examples of inventory. My experience in the lab, we tend to have some bad hoarding examples of, I ran out of medium gloves one day, and that's never going to happen to me again. So the next shipment of gloves that come in, I'm going to swipe a box of those gloves, and I'm going to tuck it away in this little drawer so that I know where it's at. So that if we ever start to run low on gloves again, that I have my gloves available to me. So sharing the story, when I was working in the lab one day, in fact, we did run out of gloves, and the lab manager came out upset, said, open up all drawers, all lockers, all cabinets, and let's see what we have. And we found 38 boxes of gloves that particular day, just from all the hoarding behavior that was going on within the lab. But it was a learned behavior. It was something that our processes didn't support. We didn't have good inventory systems in place that assured us that we had the supplies that we needed when we needed those. So it exacerbated some of those negative behaviors, if you will. Motion is another form of waste that we would look for in lean in the laboratory, and that's running around looking for those supplies, looking for specimens that we can't find. Where's the centrifuge located? I need to centrifuge the specimens that are going to be, the specimens are going to be used for this particular test, but yet the centrifuge is 3 aisles away from the actual testing area. So what is the physical layout of the space? How do we make specimens flow in a more linear or a U-shaped fashion as opposed to more of that crisscross that a specimen goes from one area around 3 benches to somebody else, and then they do their thing with it, and then they take it across 2 more benches, and then it goes to the back hallway before it ends up back up front again into a refrigerated area. So what is the physical layout and design of the lab, and does it make sense for the flow of an individual specimen, or particularly those specimens that we share, such as body fluids and microbiology specimens, perhaps. The next form of waste is weighting. I think I talked about that quite a bit in my example with the racks, where we have specimens and we batch them and we just collect them before we put them on an analyzer, and the analyzer may be random access where you can immediately put things on, but yet we stuff them in racks of 20 or 30 before we perform the test. I recognize that sometimes there's some QC considerations there that go into play, but in general we want to be looking at how do we reduce the amount of weighting that a specimen sits before we can add the value to that specimen and generate the results. Overproduction is we tend to make more than is necessary. So for example, I have on here expired reagents, that we use 100 ml of a particular reagent every week, but while I'm at it, I'm going to go ahead and make up a half a gallon of it just so I don't have to do it again. And all we do is produce more than we need just to throw it away. So we've used more than is necessary, and it just gets pitched. Or outdated forms. We have an outreach lab business, and we get 100 specimens a day, 100 specimens a month from this particular doctor's office. But I can get a really good deal on printing cost, if I order them by the thousand. So I'm going to order 1,000 of them instead of ordering the 100 that I need, and then that's going to take up space that most laboratories don't have. So we tend to overproduce and make more forms and reagents, or in pathology we make extra slides. Heck, while I'm cutting this tissue, I'm going to make 4 slides instead of the 2 that were actually needed and requested. The next one is overprocessing. Overprocessing is where we're generating, more value perhaps than is really necessary or asked for. So, for example, we order. I'll use culture sensitivity. So on a urine culture, we tend to know what bugs are going to be susceptible to what antibiotics, but yet we're going to go ahead and perform a sensitivity on it anyway. And are we really just putting money down the drain by over processing and doing more testing than is necessary? Manual differentials, are we doing more manual differentials than are necessary, given the fact that the instrumentation looks at many more cells and have had the measurement systems analyzed to make sure that they in fact are accurate, and are there opportunities in that area as well. And the last thing I want to talk about are defects. Those are usually pretty self-explanatory when it comes to specimen identification errors, hemolyzed specimens that get rejected, maybe recuts on pathology slides, results are late on a turnaround time against a turnaround time expectation. Those are pretty easy defects to define and recognize. But a new thing that I challenge those on the webcast to be thinking about lean in their laboratories or looking around is any time that I see something sitting around and not progressing and value isn't flowing forward, how is that considered to be in our mind a defect and something that we should investigate and look for opportunities to improve. So with that, that's my fast and dirty initiation and introduction into some of the foundations of the lean principles, the 5 lean principles, as well as how lean fits into a larger operational system or a lean management system. And I chose to focus specifically on lean standard work, thinking we may have some management people in the audience today that may get some value out of perhaps a different way to work as a leader, as opposed to just changing the way my staff works. But how do I change the way I work as well? So at this point, I'm finished with my slides. I'd be happy to take some questions at this time from the audience.
Thank you for that informative presentation. I am thrilled to be part of Cardinal Health Lab Exchange. Before we get started on the question and answer session, I would like to remind our audience how to submit questions. You can submit questions by typing them in the Q&A box, which can be found by clicking on the green Q&A button at the lower left of the presentation window. We'll try to answer as many questions as we can. And our first question is from Mary at St. Vincent's East, and she asks, what are the latest ideas in ways to improve morning round blood collections? We collect about 120 patients every morning starting at 3 o'clock.
All right. Well, thank you, Mary, for the question. I'll put in a disclaimer to you here. I'll share some thoughts, but I also don't want to pretend that I can solve your problem sitting in an office somewhere, perhaps hundreds of miles away from you. So my first advice would be to really just understand the problem that you're trying to solve, and understand what the expectations are in the performance expectations for your customers. A couple things that interest me is when you say you collect 120 specimens every morning, there's a lean term tact here that I want to consider is what is the pace that we need to work at. So if we understand that a lab draw takes 7 minutes or whatever the time is, and I have to get 120 of them done, what is the pace that I have to work at? So how many do I have to get done every particular each hour to remain on pace to meet whatever expectations it is. So part of me would want to say, how do I understand my pace that I need to work at? How do I make it understandable and visible to everybody that we are on pace and we are getting things done in a timely manner, as opposed to maybe falling behind? But more importantly, the thing that scares me a little bit is the starting at 3 a.m. When I was working in the lab, that we did something similar. I think we started at 4 a.m. and it always concerned me around, is that really patient-centric? If I'm ill and in the hospital, last thing I want to be done is woke up at 3 o'clock in the morning so somebody can draw what is really a routine complete blood count. So I think that there's some opportunity to say, how can we improve the process so that we don't have to wake people up as early, but maybe a little more innovative would be to consider, why are we drawing routine blood work in the morning in the first place? Are there opportunities for us to draw that routine CBC at 10 p.m. before the patient goes to bed, and maybe is a little less inconvenient than the 3 a.m. draw, but that way we can really assure that the results are on the chart when the physician does their morning rounds at, say, 7 a.m. Is there an opportunity to balance workload and change the collection times to earlier the next day, as opposed to this huge bolus or this huge batch of work all happening at the same time in the morning? Is how are there opportunities to balance the workload and spread that out over other hours of the day? There are some analytes that the results will change over over time, cortisol, for example. But really, this is a routine CBC that's being drawn for the 4th day in a row, unless the person is bleeding outwardly. Is it really going to change between 10 p.m. and 3 a.m.? So I think that that's a food for thought of, is there opportunities to rebalance workload and understand TAC?
That concludes the questions. I would like to thank our sponsor, Cardinal Health, for making today's educational webcast possible. Today's webcast will be available for on-demand viewing through October of this year. You will receive an email from LabRoots alerting you when this webcast will be available for replay, and we invite you to forward that announcement to your colleagues who may have missed today's live event. See you next time. Goodbye.